Hi everyone, my name is Crystal and welcome to another session with Dental Shadowers. Today we have Dr. Demla, who is a general dentist on our platform, speaking about her life through dental school and her other experiences. I would like to take this time to thank Dr. Demla for coming on our platform and speaking to all of us. And whenever you're ready, you can take your presentation away.
Awesome. Hello, everyone. I've got a presentation today about just my pre-dental path, my path through dental school, and then where I am at now from after that. My journey to dentistry, sorry, pressing all these buttons. So I went to undergrad at the University of Oklahoma, and then I went to dental school in Tennessee. And then after I finished dental school, I did a 1 year residency in general dentistry back at the University of Oklahoma. The 1 year residency that I did was called an AEGD. There are two types of general dentistry residencies. There's a GPR or an AEGD. Um, the GPR is more hospital based and the AEGD is more clinical based, but I can tell you a little bit more about that once we get there. So my pre-dental path in high school is when I actually started shadowing a dentist. I actually went and shadowed in the 11th grade of high school just because my dentist was super awesome and he always encouraged me to come in and just come hang out. So I thought that was an environment that I really wanted to check out more of. And so that was a really great introduction because I knew exactly what I wanted to do when I got to college. Um, and when I got to college, I decided to major in science. And then I had really big interest in business, so I decided to make that my minor. Um, and then throughout college, I think every single year I did something that showed commitment to dentistry. So when I first started out my freshman year, I joined the pre-dental club on my campus. And then sophomore year came around and I started shadowing even more dentists in the area. I volunteered at the Mission of Mercy, which I believe every state has their Mission of Mercy where they're able to give back through free dental care. Um, and then I attended events at the dental school in my state. So they would host pre-dental events for pre-dental students, just a good, really good way to start getting known in the dental school in your area if that's the one that you're wanting to go to. And after that, I decided I wanted to do research, and it was also part of my honors college curriculum because I decided to join the honors college in college as well. And so I decided to do dental research. So I got in touch with the dental school in my state, and they were really open to me coming in as a pre-dental student doing a research project of my own there. So that was really nice. And then I went to the country of Panama on a global brigade trip to provide dental care. And then this year was really busy because that's when I started studying for the DAT. And then I took the DAT twice. So don't let that deter you from thinking that taking it once is the say all end all when you're trying to apply to dental school. And then senior year, I waited the results of the application cycle and I started working at a dental lab. So I got to see all aspects of dentistry throughout my college journey, which was really nice because it really shows how committed you are to the field, especially as a pre-dental student. So here are just some pictures from my pre-dental journey. On the left is a picture of when I had my research day over my project. Um, in the middle is a picture of a Smiles 5K hosted by the dental school in my state, and I got to participate with the lab I was working with. And then on the right is a picture of me with a child that came for dental care in the country of Panama. So, advice for college, definitely do what you love. I think, majoring in a science isn't a requirement. Of course, it does help when you get to dental school to have that extra science background, but you don't have to major in a science. Um, there were students in my dental school class that majored in several areas of business, art. So you can do what you want to, but still get where you want to. And then, like I said, find ways to show your commitment to dentistry throughout your pre-dental journey. Um, I wish I had started working at a dental lab a little earlier because it was nice to be able to work on my hand skills there and kind of see a different side of dentistry when you put the whole picture together. And then, of course, don't forget to have time for yourself. College is really hard with everything going on and all the classes and requirements you have to take, on top of all the shadowing and the hours you're putting in towards reaching your goals. So definitely don't forget to have time for yourself. And then my dental school journey, I went to Tennessee. I did apply to Oklahoma, even though I went to undergrad there and I am from Oklahoma. Um, but I didn't get in Oklahoma. I was on the waiting list there, and I got into the state of Tennessee. And so that's another thing as a pre-dental. Don't be afraid if you have the opportunity to apply in other places because you just never know where you might get your chance. Um, and so in dental school, the first and second year were basically didactic and lab work. These are just pictures of different typodont preparations that we were doing. And then my class as well, we were a class of 104. And so the first and second year are really rigorous because you've got a lot of tests, a lot of learning, and a lot of lab work getting you prepared to take care of patients. And that's where kind of the science field of a major in that area kind of helps because you've got a lot of those science classes the first and second year. Um, and then third and fourth year was patient care. So, of course, me and a lot of other graduates. So I graduated in 2022, so COVID affected me. And so my third year of dental school, I wasn't seeing that many patients just because the dental school was also encouraging fourth years to have priority with patients just because it was really hard because of COVID. Um, and that's kind of how I decided I wanted to do an AGD program. And COVID kind of led me to believe that I definitely wanted to focus more on other aspects of dentistry and also kind of see where my strengths and weaknesses are, especially since I felt like I wanted an extra environment to learn a little bit more before I was ready to go out in the real world. So advice for dental school. You don't want to compare your progress to someone else. So you're coming in and everyone's learning all these new things all at once. And you don't want to compare how fast someone else is grasping a subject or a concept in the lab than you are. And then lean on your classmates. There's 100 people in that class, or there might be 50 people in your class, and we're all there for one reason. It's really nice to help each other out. And it was nice because that's the only way I got through dental school was being able to really lean on my classmates when times are tough. And then some days are really hard, and sometimes you just have to remind yourself why you're here. Um, I actually reread my personal statement as a pre-dental student the other day, and I was like, wow, like this was something I really, really wanted to do. And some days it is hard. I'm not gonna lie, but you just have to remind yourself why you're here and what your goal was from the beginning. And so, why did I choose an AEGD? Um, there's the ability to learn advanced procedures, the ability to use the newest and latest technology, the ability to collaborate with specialists and learn from them, and the ability to better understand your strengths and weaknesses. So I talked about earlier how there's two different types of general dentistry residency programs. So GPR, you're dealing with hospital-based patients and the hospital team. And an AGD is more like a private clinic setup, and they're mostly in dental schools. And so you get a chance to have that private practice environment, but also get to learn a little bit more. So my AGD year in review, what did I do? I completed molar root canals. I did retreats. I placed 20 implants. So not a lot of dental schools allow you to place implants. So that was a really, really awesome opportunity. I got to do Botox and filler, worked with all the latest technology, including 3D printers and CAD CAM. And then I worked with a lot of advanced cross cases and did a full mouth rehab. So I got to learn a lot and I got to see that dentistry wasn't just, doing fillings, crowns, and taking care of patients in that way that I learned in dental school. As a general dentist, you have the opportunity to focus on an area that you're really, really interested in, which is really nice. So here is a case that I did in AGD. I had a patient, she's an 18-year-old female. She just completed her ortho treatment, and there was space left in the area of her congenitally missing laterals, which means she was born without her laterals. So the front two teeth next to your centrals. And then she also still had a baby tooth on the bottom that still never had a premolar that came in. So she came to me for a consult, and I got to plan with the team of specialists at the AGD and got to interact with the professors and the specialists that we have at AGD. And it's really cool because we had all of this advanced technology. So I got to design my own surgery guide. I got to print it in the 3D printers that we have there, and the two x-rays on the right show the implants after I placed them. So after about 8 weeks of healing, we were bonding a tooth-colored material, the filling material in between just to imitate a tooth until things started healing. And then we got to create a temporary for her that attached to a screw. So you can see here that we had that temporary screw here, and we got to put a crown on top of it. That would be a temporary crown for just a little while until she's finally done healing. And then unfortunately, because AGD is only a year, I don't get to see all my cases all the way through. But I got to text the patient's mom, and she was so happy with the results. And you get to see the difference that you get to make in someone's life when you get to do these big cases like this. And if it wasn't for AGD, I definitely would not have gotten this opportunity this early on in my career. So I'm really glad I got to have that opportunity. And then advice to future dentists. You want to stay committed because things might not go the way that you want them to, but you don't want to give up. You might not get in your first cycle or your second cycle, but if it's something that you're really committed to, you'll get there for sure. Really do well on the DAT. I feel like that's something very important. Schools really take a look at that, and don't be afraid to take it twice. If they see that you've improved between the first and second one, that speaks volume about your commitment as well. And again, it can be hard some days, but one day you'll look back and see how rewarding it is to be in a position where you get to make a difference in someone's life. And then I know that sometimes it can be hard to prepare for application cycles. So recently I've decided that I'm going to help other students that need help reviewing their personal statements or want to do mock interviews, that they can definitely contact me, and we can do some of those things to see what we can do to get you to dental school. Yeah, it was really short and sweet. I just wanted to give a little glimpse of my journey and where I started and how I ended up here. And then, of course, if you have any other questions or want to know more about anything that I mentioned, just please reach out to me.
Thank you, Dr. Demla. Again, as she said that her social media account is listed on the screen right now, so give her a follow along with her contact information with like her Gmail account is also there for her email. We can move on to the Q&A session if you're ready.
Yeah.
Okay, perfect. We did get a couple of questions in the chat. The first question is, how is dental lab like, and do you prefer clinical or research? And is dental research an important component of the application?
Okay. Repeat the first part for me.
Okay. How is a dental lab like?
A dental lab is basically the behind the scenes, and you really get to see how everything connects. As a dentist, you may prep for a crown, or you may take impressions for night guards, for whitening trays, for dentures, and the real work is behind the scenes at the lab. So there I was pouring up impressions that came in from dental offices. I was scanning cases in, as a lot of things have moved towards scanners. So got to scan in cases and that were crowns so that things could be milled. And it's a different aspect of dentistry, but if you even shadow at a dental lab or even get to go visit one, you'll kind of understand how everything fits together. Where this process starts from when the patient comes in to when the patient leaves with their filling, crown, all of that. So getting to be behind the scenes at a lab is really awesome.
And the second part of that was, do you prefer clinical or research?
Um, I preferred clinical for a long time, and then in my AGD, I realized that research doesn't have to be can be anything that you want it to be. So in AGD, we did a research project over Google reviews, and that was really cool. So I mean, research can be anything that you want it to be. I don't have a preference for one or the other. They're both really, really interesting to me.
And then the next one was, is dental research an important component of application?
No, it's not. It's just something unique. I think, like I said, there's so many different ways you can show your commitment to the field of dentistry, and that was just one way I decided to show that I was still really interested in different parts of dentistry.
Next question is, when you were studying for the DAT, what did you use?
I used Boot Camp, I used Destroyer, and then I also sought out a tutor just to go over any concepts that I might have been missing. I don't remember where I got the tutor from, but she was a previous pre-dental student who was in dental school, and she was offering DAT tutoring services. So, the best way to really know how to study for the test is to ask someone that studied for it before you. And so it was really nice because she went over concepts that I was still struggling to comprehend before taking it the second time.
Next question is, what did you look for in a dental school when you were applying?
Um, for me, I'm the first dentist in my entire family, so for me, it was mostly I would go wherever I got in. For me, I think it was a privilege to just be able to apply and be able to go to dental school. So I honestly was open to going anywhere. I just applied broadly, and I just made sure that the program really focused on clinicals for sure. So. That's something that was super important to me because I knew I wanted to leave to at least have a really good understanding of clinicals.
The next question is, how do you balance work and social life?
Just planning things out. Having your priorities and what you want to get done that day. And that's really, really important is just to be really strict with yourself in the sense that, this is what I'm going to get done today, and then I'll be able to go and do this after. Just setting a goal and then keeping it in mind. And, some days you may not get to it, but you just know that at least you marked a couple of things off, but, just making sure you have it planned out.
So someone in chat is asking, so we may message you if we would like help with our personal statement.
Yeah, for sure. Let me go back to the other slide. Yeah, you can follow me on my social or send me an email and we can figure out just where you're at in your application cycle, what draft you're on, if you're starting out, if we need to brainstorm, wherever you're at in the process, we can figure out what we need to do.
And another question is, how did you find out information on a program regarding if they are more clinical or research based?
Just emailing the program for a tour and getting to visit with them. And I knew that Oklahoma was very clinical based just because I also met with previous students as well while going to those different events. So, like I said, it's really important to be involved in the school that you want to go to as well, because sometimes they'll host pre-dental events. Um, I got an interview at Tennessee and I had applied there just based off of other dentists that I knew were alumni from there, and they spoke really highly of their clinical program. And so just doing kind of your research and getting to know other students or alumni from those schools.
The next question was, what was the most challenging part of dental school?
Mm. I think the most challenging part was definitely during COVID. We had patient requirements at my dental school, so there was a certain amount of procedures we had to complete um, within each department or aspect of dentistry. And it was really hard during COVID because not that many patients were coming in. It wasn't until my fourth year that I really got to see a lot more patients just because the school started to see that the fourth years were struggling with finding patients. And by then things started getting better too. So definitely third year was hard.
Next question is, what motivates you to go in and work on patients each and every day?
Just knowing that you're making the difference for someone in some way. I mean, at the end of the day, they really appreciate what you're doing for them. And knowing that you're in that position and you're given the privilege to be a healer for someone and be there for someone and take care of them. Honestly, at the end of the day, that's what's the most rewarding.
The next question is, did you ever think about doing a postbac or a master's program before going into dental school?
I didn't, but I had a couple of classmates that did, just because they uh, wanted to further their education and things they were interested in. And they also wanted to take a year before applying to dental school. So everyone's path is different. But it's really nice because once you get to dental school, you get to meet students of all different walks of life. We had students who were teachers for many years and then decided to come back to dental school, or took care of their family for many years and then decided to apply to dental school. So however you want to create your path, I know that in the long run, it's a really cool story to have.
The next question is, how did you find the volunteer trip opportunity?
Yeah, so at Oklahoma, they had an organization called Global Brigades. And so I knew that they were geared towards healthcare professionals that wanted to go on a volunteer service trip. So it wasn't just dental, it was dental, medical, and optometry. So I got to go with my sister, which was really cool because she went the pre-med route. But I would just look up Global Brigades and see if there's a chapter at your campus. Um, and then if not, I know that my dentist, he always talked about different trips he would go on to provide care in different countries. So even reaching out to dentists in your area and asking them if they know of any opportunities for you to go and volunteer in another country to provide dental care, I'm sure they'll have some resources for you too.
One last question I see here. Were there any other specialties that you thought you would have gone into if you hadn't just like pursued AEGD?
Not really, just because I felt like as a general dentist, you don't have to do the same thing every day. You kind of get to choose what you want to do, which is really, really nice because I got to see that I was interested in Botox and filler. I got to see I was interested in doing cosmetic dentistry. These are all things that you get the opportunity to look into as a general dentist. Now, that doesn't mean that I wouldn't maybe think about doing it in maybe 3 or 5 years, There's a lot of students that will graduate dental school, be a dentist for a little while, and then go back and do another specialty that they find they're really, really interested in. So your path doesn't have to be right after dental school either. But for now, I think I want to stay a general dentist.
I think that's all the questions we had. If anybody has any other questions, if you could send them in the chat now, or then we'll just wrap up. I'm just gonna wait a minute, see if
No,
anybody
yeah,
has,
you're fine.
yeah.
I'm going to pause my screen share
Yeah,
and
no
I'll
problem.
put my email and social in the chat too.
Thank you. If anybody has any last minute questions, we can have those answered now. I actually don't think there's going to be any. I don't see any in the chat. So I'm just going to wrap it up. Again, thank you, Dr. Demla, for coming on our Dental Shadowers platform and holding the session with us. Your advice and learning about your journey and experiences were really helpful. Again, Dr. Demla just gave her Instagram handle and her email for anyone who wants to do any mock interviews or like to read their personal statement. So reach out to her whenever you want. And again, thank you for joining our session, and hope everyone has a good night. And there will be an attendance quiz that's going to be posted later today, so just be on the lookout for that on our Instagram, and along with this video that will be posted on YouTube later tonight. Again, thank you for everyone who joined tonight.
Thank you.
Thank you.
Bye.